My professional background is I've been a Chief Information Officer, or CIO, for about 30 years in healthcare. So I became a CIO before it was called CIO in healthcare. It's a role that's been evolving for some time and becoming more and more relevant to healthcare and its delivery as technology has been advancing and as new tools became available and part and parcel to how we deliver healthcare. So yeah, I've been CIO for Holy Cross Health System for 12 years, 13 hospital system out of South Bend, Indiana. It is now part of Trinity Health, so people know it now as Trinity Health, which is a very large Catholic health system. And I was CIO for Scripps Health here in San Diego, 6 hospitals at the time, then we divested one, became 5 hospitals, and there's about 3,000 providers there, doctors, who I came to help integrate. The Scripps Health had grown by merger and acquisition, and so by definition all the different hospitals and clinics, there's probably about 45 clinics or so, had different systems, and a lot of them were failing and in not very good condition. So my job was to rebuild the infrastructure, the information technology, architecture from the ground up. And so I did a whole strategic plan for IT based on a very solid enterprise business plan that had been created for Scripps Health to become a health system, a new health system. So I used that as my guidepost and just created a technology, an integrated enterprise-wide technology, and they now have an electronic health record so that no matter where in the Scripps system a patient shows up, their data is able to be combined into a patient-centric record. We did a lot of other things too, created some business intelligence systems and new financial systems, really everything. So it was a big experience there, and I learned a lot about how to connect patients with providers. So, yeah, and I teach at UCLA. I teach health information systems and technology. I've written a textbook on essentials of health information systems and technology. I'm passionate about this topic, love data, and so it's something that I enjoy very much, is teaching people who are either budding managers or administrators in healthcare, people who will become hospital administrators or run clinics or manage businesses in healthcare, or physicians and nurses who want to learn about IT. So I love teaching lessons I've learned. We started Bootstrap Incubation about 5.5 years ago, and we have looked at hundreds of startup companies. All of them have either a life science or a healthcare IT theme in them, and we try to always be looking at new companies that are trying to move the ball forward, create a new way of doing things, really improve the way that healthcare is delivered or the way that science is conducted, to help research get out of the lab and into practice more quickly, a variety of things like that. So we've had a lot of fun kind of seeing what people are doing. I think there's a new wave of technology enabled solutions coming out now. We've kind of saturated the electronic health record requirement. Most organizations now in healthcare have an electronic health record. So now the next challenge is we've got to make those work better, more seamlessly. We've got to connect patients more easily to their data, and we've got to keep moving forward. I think a lot of us who did electronic health records and integrated health systems thought, wow, that's the answer, and everything's going to be so much better when we do this. And a lot of that's true, but that's just kind of getting started, is to get that in place. But now we have the opportunity to do more with that capability. That's kind of like the baseline. And now we're connecting patients better to their data in health systems and in their providers' offices and everywhere else. But now we have a whole new opportunity to kind of take the next step and really step outside of organizations and create a new ecosystem, if it were. Blockchain is an exciting new technology and very interesting to look at as far as what we can do with it. Really because it enables more secure transmission of data, more precise identification of data and who it belongs to and who it's going to. And these are rampant problems becoming worse and worse every day, and not only in healthcare but in our society at large. Blockchain also allows us to, of course, with using the new currency and all, to create really a new ecosystem that creates opportunities for people to have incentives to adapt to new behaviors and to take some of the power that comes with currency away from the central organizations that hold and house really the money right now, which is the main currency. Payers, for example, health insurance, requires payment of funds into payers. Reimbursement comes for care. Wherever that currency is housed, the central place for that gains power. Banks, things like that. By distributing that out to people and to providers, who are the two essential elements of healthcare, we can really reshift the balance of power in healthcare. And I think that's a lot of what's going on. So for me, it's democratization. I believe that people have a right to healthcare. I believe they have a right to their own health, they have a right to their own data, and they have a right to have a personal, kind of private relationship with their provider. I think the patient-provider relationship is the sacred relationship in healthcare. It's not that the payer should be the third party who is outside that particular, relationship and should serve that relationship. I think organizations have become the center of focus as a result of how the business of healthcare is set up, especially in the United States, and that has made it very difficult for patients and providers to do their role in healthcare. I think that what blockchain allows us to do, and cryptocurrency and these new ways of interacting, is to rebalance the power, if you will, in healthcare and the relationships. Payers have their place, pharma has their place, large health systems have their place, but they shouldn't have as much power as they do in controlling who gets access to care and to their data. These are major problems right now in healthcare, and I think that blockchain can really help us. I became involved in MD Health through my relationship with Samir Damani and Vish. I am the CIO also for MD Revolution, which is a company that we came across in our due diligence of startup companies with Bootstrap Incubation about 5 years ago. And we met Samir first, and pretty much that changed our lives because we found another person who believed, I think, what we believed in, which is that, and shares a passion for the vision of really connecting patients with providers and data and the like, and knowing that how things are not okay, and just really having, I think, kind of a stubbornness and a will to just try to do this. I've been trying to do this, attempting to do this my whole career. It's just you can only get so far with each step. Electronic health records got us a certain part of the way there, but now we're taking new steps. So as CIO of MD Revolution, we have been connecting patients with providers to help them manage their chronic illnesses and to continuously monitor their condition and things like that. So it's very much akin to the vision and ideas of now with blockchain. We can with MD Health, we can take that to the next step in a big way. I think blockchain in this case really adds a capability that we need to be able to really go further and have a very extensive, not only connection with patients, but in creating a new ecosystem to empower patients and empower providers in ways not just with connectivity, but to take control of that data so that patients really own that and can control their data, and that relationship gets even stronger by creating that new ecosystem and having a currency that we can use for ourselves. The power of the payers in terms of who controls the dollar has always, you look at any health system in the world, whoever controls the dollar used to pay for healthcare controls healthcare, period. So by distributing that and democratizing that, we can really shift the ball game to where we've been trying to for all these years. So that's how I got involved in MD Health. I'm very passionate about this, and I think that Samir and Vish and I and others involved in this, we can't not try to do this. This is how we are.